Good morning, good evening, good day, and I'm Rene L, a Zimbabwean and Director of Training and Research Support Center, and I'd like to welcome you to this panel on plural pathways and shared principles to co-building a health in a new ecosocial world. So we'll be discussing in the panel how healthy societies are conceptualized and the way this affects how they're achieved. And we know that global positions and policies tend to present a view that sometimes masks the diversity that exists within our regions of the world in how we think about healthy societies. And we also know that there have been different and contesting approaches that have existed and coexisted across centuries in this kind of thinking about healthy society. So we'll be exploring in the panel today, given the kind of threats we have to health from pandemics, from climate change, and from ecological destruction, how we think and act on healthy societies and how far the choices that we make are understood and made beyond elites and states by society itself, how this can lead to quite different futures for us as a collective. So I'm very happy to welcome in thinking through this issue, in posing kind of questions about it, colleagues who will join us to reflect experiences from India, from Latin America, from Eastern Southern Africa, and from small island states, and from the global level. And thanks very much to the colleagues who are joining on the panel. Eugenio Villar from Universidad Peruana Cayetano Heredia in Peru, Rama Baru from Jawaharlal Nehru University in India, Min Garcia from Manila in the Philippines, and Robert Marten from the Alliance for Health Policy and Systems Research in Switzerland. So welcome all of you, and thank you for being part of this panel. And let me kick off the discussion by asking Eugenio, turning to you first. So how have ideas in the context of Latin American history and the historical context of Latin America emerged in new forms to address the current challenges that are being faced to health and well-being in Latin America? What's the experience there, Eugenio?
Thank you. Latin American historical experience illustrates how a holistic pre-Hispanic buen vivir approach to health that was inherently linked to nature, Pachamama in our native language, Quechua, and to social and community harmony showed features now emerging in current planetary health paradigms. The conquistadores brought not only epidemics and extractive economies decimating our indigenous peoples, but also a dominant biomedical approach that was delivered through charity and religious institutions. This separated Spaniards and Indians in an apartheid mode. As capitalism replaced all semi-feudal systems, the biomedical approach was scientifically and commercially reinforced and expressed in market provision of healthcare that benefited only the upper classes, while traditional medicine remained the only available service for the indigenous and African majorities. Social medicine approaches reached our coasts from progressive European thinking that had surged there during the Industrial Revolution. While social medicine was not applied in many mainstream healthcare systems, there were exceptions, like the inspiring example of Cuba or the National Health Service under Salvador Allende in Chile. Social medicine ideas, however, stimulated and offered alternatives for health and social anti-colonialist and anti-capitalist movements. More recently, leftist governments were brought in the 1990s in struggles against a neoliberalism that escalated already huge regional inequities. These governments adopted buen vivir, social medicine, and comprehensive primary healthcare approaches, some including them in their constitutions. While this is not substantially changed already established biomedical care models, in some countries these ideas were used to improve social well-being, as well as to create or expand public universal provision, as in Brazil in the 1990s. Despite this regional left wave, inequities have persisted, with challenges in extricating from a dominant economic neoliberal system. An intercultural health approach has now added a dimension that has permeated several health systems as a response to the ethnic diversity within and across countries, and as a recognition of the social determination of health, that is the political and social factors that underlie many factors affecting health, and particularly to confront expanding health inequities. The tragic COVID-19 pandemic has made it even clearer and widened consensus on the need for an approach that challenges health inequities at its root causes, and that this calls for substantial change. We are entering now to the next segment. Okay, good. Let me then ask Rama. Rama, India is known for its indigenous health systems, but also for being a biomedical and medical industrial complex. How did local ideas and movements engage with this drive for modernization and its consequences? Rama, please.
Thank you, Eugenio. India has a rich history of indigenous and folk medical systems that had a holistic view of ecology, health, and wellness of populations. With colonial rule, there was imposition of biomedicine that became the powerful and dominant system, building a medico-industrial complex that drew in many health professionals and promoted the market in health services. There has, however, been a rich debate within India to contest the dominance of biomedicine and recognize its limits. The Gandhian movement in the 1900s engaged with indigenous systems and gave legitimacy to alternate conceptualization of health and well-being as grounded in people's lives, living, and social conditions. Grassroots and community social movements advocated for people's health in people's hands. A demand not only for a voice in decisions, but for recognition of the role society plays in improved health. This contributed, for example, to some of the thinking behind the community health workers and also comprehensive primary health care. This, along with radical critiques of biomedicine, fueled several community health projects and movements that engaged with equity, social justice, and democratic decentralization. With increasing privatization of health services during the last 3 decades, the spaces for plurality have been shrinking. It's an uphill task for academia and civil society to engage with the complex reality of the agenda of capital accumulation being pursued by the present government and the challenges of degradation of the environment, inequality, and its consequences for the health and well-being of the population. Min, having heard these experiences from Latin America and India, can you share how the lived experiences in the small island states in the Caribbean and Pacific Islands have informed action on health and well-being?
Thank you very much, Rama. In my view, the pathways to healthy society requires us to think about a kind of governance and policy response that is committed to addressing gender and intersectional inequalities and differential impact of the interlocking crisis in the context of social, economic, and ecological justice. Prevailing inequalities within and between countries with deep roots in colonialism and racism mean that people who have more capture the benefits of nature and export the cost. Such is the existential threat to small island developing states in the Caribbean, the Indian Ocean and the Mediterranean, and the large ocean nations in the Pacific. We need to highlight how people's participation in governance supports global, regional, and national collective action in addressing commercial and political determinants. Since 2009, small island developing states have been calling to limit global temperature rise to 1.5 degrees Celsius, above pre-industrial levels to prevent the worst of climate change impacts. The inclusion of this temperature limit in the 2015 Paris Agreement was a major victory for vulnerable countries. Since 2015, hashtag 1.5 to stay alive has been making the Caribbean's case for 1.5 degrees. An initiative of Panos Caribbean, the campaign has harnessed indigenous knowledge and culture through theater, music, poetry, and short stories in its advocacy for climate and social justice. In Trinidad and Tobago, the Rastafari women's activism for the environment has been working with and on the Fonds Aman's Community Reforestation Project. Co-founded by Akila Jaramogi, a member of the Rastafarian community, the project started in 1982 as a movement of community members working together to eradicate the annual threat of forest fires with the Fonds Aman's watershed. On the other hand, the Caribbean Natural Resources Institute, or CANARI, is an example of a homegrown non-governmental organization facilitating and promoting participatory approaches to natural resource governance to conserve biodiversity, engaging in policy in and around the region, and working with local resource users and rural communities in the Caribbean, and also amplifying less heard Caribbean voices in policy discussions in regional and global spaces, such as the CARICOM community, the Organization of Eastern Caribbean States, the UN, and the Commonwealth, among others. In the Pacific Islands, social movements and coalitions have been organized to advocate for health and climate justice. Among them, the Pacific Partnership on Gender, Climate Change, and Sustainable Development, and the Pacific Feminist Coalition for Sexual Reproductive Health and Rights. These coalitions were born from the coming together of diverse voices and actions for equality, the Pacific Youth Council, DAWN, the Fiji Women's Rights Movement, and the Punanga Tawututu Women's Counseling Center in Cook Islands, among others. They're all bringing people's voice and analysis into various dimensions of the interlocking crisis. Another grassroots initiative is the Feminist for a People's Vaccine campaign, facilitated by the Development Alternatives with Women for a New Era, or DAWN, with its base in Fiji, and the Third World Network, or TWN, based in Malaysia, bringing together activists from the Global South and allies in the North. Although not limited to small island developing states, they actively bring feminist perspectives from these areas and the wider South and challenge the causes and consequences of intersectional inequalities that shape the access to medicines. The Feminists for a People's Vaccine campaign analyzes the rapidly changing panorama of COVID-19, the TRIPS waiver discussions, the COVAX facility, and the geopolitical imbalances in global trade, investment, and financing, and brings a lived experience on how this is impacting countries and people in the margins. Thank you. Rene, all these experiences seem to signal the connection between the lived experience and grassroots movements in ideas that challenge inequality. How have the context and the experiences of East and Southern Africa infused current thinking on health and well-being, especially in the face of current global challenges impacting on people in the region? Maybe you can expound on this question. Thank you.
Thanks. Thank you, Min. Yes, we know in East and Southern Africa that our region has the resources for health and well-being of its people. It's a richly endowed region. But like Eugenio and Rama and yourself have said, the resources are inequitably distributed. And indeed, for our region, many of them are exported outside the region. And For example, from our own evidence, some of the highest food producing districts in our countries are also the districts that have highest levels of malnutrition. That kind of contradiction between the possibility and the benefit. So in this global economy, we tend to be producing what we don't consume and consuming what we don't produce. We also have found in our work that districts with very high shares of extractive activities, mineral resources, oil, and so on, are also those that have very high levels of poverty, particularly in the surrounding communities. So this sort of inequity contradicts very basic principles and values that were central within indigenous society. And these included values such as Ubuntu. Ubuntu is the term which is used a lot in Southern Africa, but more widely, it refers to reciprocity, the kind of reciprocity where one's well-being was an outcome of the well-being of others. So I say, good morning, how are you? You will say back to me, I'm fine if you're fine. And I'll say, okay, well, I'm fine if you're fine. This notion that your well-being is connected, and not only to each other, but to the physical, social, and spiritual well-being and the connection with nature, which made people very sensitive to the balanced use and the knowledge of the local biodiversity that was critical for health. Well, these ideas were deeply suppressed during colonialism, militarily, but also in terms of knowledge systems and other institutions. And they've also been marginalized by a concept of development that equates progress with the neoliberal globalization that Eugenio and Rama were talking about, and especially where global rule systems that, such as you were talking about, Min, and the influence of powerful transnational corporates have limited public sector policy action in the region. However, I need to say that the liberation struggles in our region that during the 20th century reflected solidarity and reciprocity between people and countries, and fought for ideas of social justice and equity. And these ideas and values were carried forward in the adoption, for example, of comprehensive primary health care and other redistributive policies in all the countries of East and Southern Africa in the post-independence periods. So these were policies that linked the concept of nation building to a desire to ensure that the key resources of the countries, like land, were used for people's well-being. For example, in public works programs, in labor policies and employment policies, in land distribution, and indeed in social services policies in the post-independence periods. However, we've seen an erosion of this with the impact on our values, on power, on life itself of neoliberal policies in the region. The structural adjustment programs that were introduced in the 1980s and 1990s on the back of debt asserted that the most important thing to do was to grow our economies if we wanted to meet social needs. And that the means to grow our economies was to cut back on solidarity systems, to cut back on our public sector services, to cut back on our labor protections, and rather to export and integrate into the global economy. So we exported raw materials and we depleted our natural resources at an increasing rate in order to do so. And with the rollback of the state in many of our countries, we actually deindustrialized. And employment fell to levels that were so low, and informal employment had to grow around that, to a point where high shares of people now live in precarious conditions alongside visible signs of modern wealth. So we have growing chronic diseases, for example, because of a shift to ultra-processed foods, where even our informal sector vendors who are selling these ultra-processed foods are acting as vehicles of corporate advertising in their vending stands. However, and that's a harsh picture. However, I do need to say that in our region, we still find expressions of solidarity and an idea of reclaiming the resources for health. For example, at community level, there's an alliance in some countries around the large mines between workers who work in the mines, the communities who live around the mines, and the various professionals, including health professionals, to ensure that the mines take responsibility for health rights, not just of the people who work for them, but of the surrounding communities as a whole. And there are also national and regional processes on food sovereignty to protect local seed stocks, indigenous seeds, and to protect indigenous farmers as a basis for food security. And we saw the importance of that during the COVID pandemic when international food supply chains were disrupted. So we also saw, I think as you've raised, Min, the kind of international efforts and treatment activism during the Doha Declaration period in 2001 around access to treatment, and now the African Alliance with a much wider set of other movements, including the social movements you talk about, in the negotiations globally on the TRIPS waiver for vaccine equity and for fairer patent systems, and particularly for more self-determined local production of the technologies that we need for health, and indeed from our African Union Ministers of Finance for fairer global tax rules. So we know and we completely understand that these kind of bring these values and ideas into practice invoke major power struggles with persistent neo-colonial global rule systems, but also within countries for local people and the sort of indigenous knowledge you referred to be heard and integrated into protecting the resources for well-being. So with that understanding of our regional base, but also the interface with this global economy, I'd like to ask Robert and to turn over to Robert Marten. How do you see these regional experiences being reflected or perhaps marginalized at the global level? Robert, the challenge is in your hands.
Thank you very much, Rene. And really, I think it's what you said in the beginning. The way healthy societies are conceptualized shapes our efforts, shapes how we go about to achieve these healthy societies. We know that global policy processes present or reflect a dominant view, and it masks significant diversity in thinking about healthy societies across our regions. We know global views are created, are constructed, are contested through a complex policy process and a cycle or loop that goes from countries to global and back to countries and back around. Yet, of course, they're different and conflicting approaches which have existed for centuries, and including our thinking on healthy societies. I think in the background paper to this session, we talk about the significant technical progress in the biomedical paradigm and the expectation that disease could be eradicated by technology and modernization, and the misguided argument that wealth from macroeconomic growth would trickle down and improve all of our population's health. Of course, one continues to see how this approach dominates in much of the discussion of the response to the COVID pandemic. Well, there's been a huge focus on developing a vaccine and improving medical treatment, engaging with communities, thinking about communicating risk, focusing on broader public health interventions. All of these approaches have received short shrift. There's been a huge focus on a biomedical approach. This focus on a biomedical paradigm has generated progress, but it's also was brought to regions in colonialism with power used to suppress local ideas, economies, and systems. And I think that the pandemic continues to highlight and really illustrate the shortfalls of this biosecurity approach, the technology-driven interventions that have ignored social realities and growing global inequity. This being said, of course, global policy also reflects and is drawn upon, energized by, inspired by some of the regional experiences other panelists have shared, such as the social medicine movement in Europe, the construction and uptake of comprehensive primary health care, the idea, the notion that health is a human right and a resource for development. More broadly, the whole of society approaches, and now in growing, increasing attention to climate and planetary health. Again, at this moment, though, I think the ongoing COVID pandemic just continues. I see this every day, again and again, how countries are adapting and adopting similar measures. You see almost kind of a wave, not only of cases, but waves of intervention. And as we continue to face this challenge, but also new challenges, the COVID pandemic, I think, demonstrates the potential for innovation, but it also kind of showcases, highlights unresolved contestation and struggle. The pandemic has exacerbated many of our existing trends. There's now even greater inequity. There's loss of well-being in our systems, with concern for what this implies for how we meet major existential challenges, new challenges. So for example, we know that the COVID crisis is causing unprecedented disruption, but the climate crisis will have even greater, much greater consequences. And I think sometimes we overlook this at our own risk because it's not maybe quite as front and center. We are sometimes the frog in the boiling pot, and we don't always notice. So I think we need to be attentive to this. We need to understand how this can help us. And I think the diversity of regional experiences can be really a strength here. And with that in mind, Rama, Eugenio, Min, I really want to come back to you and get your comment, your thoughts on the implications of this global context, this global crisis for an eco-social global. Rama, over to you for your thoughts.
Thank you, Rob. I think the post-COVID-19 scenario has provided an opportunity to revisit the fault lines that you were talking about, not only in our health systems, but also in our political economies. It has clearly shown the need for the state to play a proactive role to address inequities in access to resources, health services, and basic needs of life. And this was very amply illustrated in the Indian context. It's very clear that public health systems have to be strengthened, and the private for-profit sector has to be reined in and made more accountable. We also need to widen democratic spaces at the community and institutional levels. And at the institution level, I also mean the scientific establishment. The post-COVID-19 scenario has actually given rise to centralizing power and suppressed voices of dissent in many places, especially from civil society. This is certainly detrimental to the health and well-being of society.
Thank you, Robert and Rama. I'd like to offer that the theory of knowledge that we have grown into was premised on a basis of consumption rooted within the society of colonizers. So this mentality has persisted, and the homogenizing effect of predominant models of production and consumption has eroded diversity in all its forms. So the transformation that we want can't be found and anchored in this knowledge system of consumption. We must problematize the current production and consumption patterns, challenge the dichotomy discourse, amplify multiple ways of knowing, and explore models of knowledge coexistence. So for example, the First Nations in Canada offers etuwaptimuk, the Mi'kmaq word for two-eyed seeing, taken from the teachings of Chief Charles Labrador of Acadia First Nation. Mi'kmaq elder Albert Marshall of the Ecosocial First Nation offered it as a transformative framework. So two-eyed seeing refers to a learning to see from one eye with the strengths of indigenous knowledge and ways of knowing, and from the other eye with the strengths of non-indigenous ways of knowing, and to weave between each respective way of knowing. An intersectional perspective in an indigenous context would juxtapose the natural symmetry of three elements of women's rights, indigenous community, and environmental justice, and biodiversity against the direct correlation between social injustice, detrimental environmental practices, and acts of violence, and its impact on women, health, well-being, and the cultural sustainability of the community. So this is an example of how contesting perspectives are positioned or juxtaposed. We must also not forget the persistent lack of Pacific, Caribbean, and South feminist voices directly engaging in global policy spaces even as the national policy terrain is narrowing, accountability is eroding, and multilateralism increasingly corporatized. Knowledge and narratives of women and communities in the margins have been systematically undocumented, unrecognized, and untold. So we need to really keep asking ourselves, whose knowledge and which knowledge system continue to be privileged? Who is driving the process of change, and towards what end? Thank you.
Thank you, Min. Inequities, understood as inequalities which negate rights and justice, are only natural in capitalism. However, what we see currently is that they have escalated in all spheres because of neoliberalism and a globalization under its influence, particularly in the last 3 decades. This is reflected in the challenges we face in relation to climate change as a threat to both nature and humanity, and in the origin, course, and consequences of COVID-19 pandemic. There seems to be a global consensus across different ideological thinking that inequities and climate change need to be urgently tackled if the world and its people are to survive. The nobody to be left behind and the indivisibility of the Sustainable Development Goals Global Compact, the UN International Panel and the Conference of Parties on Climate Change deliberations on climate, and the increasing evidence of the inevitability of new pandemics do not leave any doubt on these top priorities. WHO and many social determinant movements, especially in Latin America, have emphasized the political processes in the social determination of health. This sheds new light that, as raised earlier, was already present in pre-colonial history on the link between nature, society, economics, and well-being, and the key role that equity as a value must play in shaping this. This implies rethinking neoliberal values of extreme individualism, irresponsible material consumption, and market obsession, and making rights, public goods, social redistribution, and social justice more central in public policy, including at global level. In health, this also means reasserting comprehensive primary health care and integrating health in all policies and in intersectoral action, including in relation to the responses to climate change and preventing new pandemics.
Thanks, Eugenio. So we've heard how much the ideas and experiences have influence in how we understand and act on health and well-being. And from this most recent part of the discussion, for the sort of existential challenges that we now face, including through climate change. And the discussion highlights that we have ideas, and indeed we've had ideas in the regions for centuries, that provide us with holistic, intersecting, equitable ways of looking and acting on these challenges, the two eyes that Min was talking about. But the lenses from the regions also show us that these ideas have been suppressed continuously in different ways, and that the communities expressing them and the knowledge that they bring to the table have often been marginalized. To the disadvantage of our collective futures. And I think Rama's intervention about the way COVID has concentrated power makes us realize that this is very much still part of our current realities that we are living in. At the same time, what's inspiring is that we see the consistent reemergence of some of these ideas that balance physical, social, and ecological well-being. And the way Robert has explained it in terms of how they interface with global processes and force attention in global processes as well. So I would like to turn back to our panelists to ask So we end on an inspiring note. People need to leave us with a sense of the fact that change is possible, an ecosocial world is possible. And the values of reciprocity and equity are possible. So I'd like to ask our panelists in a quick sentence or two, can you tell us what you found inspirational for reflecting the sort of propositions that you've been arguing in your discussion? And I know you've been raising some examples as we've been going along, but let me ask Min first. What's inspired you?
Thank you very much, Rene. I think in building a future where the planet and people thrive in their diversity, I'm inspired by those making the demands that first, we must resist all forms of oppression and violence. Second, we must persist in building a global and national public health agenda, responding to specific health and well-being needs of women, men, and people in all their diversity, and underpinned by social justice and cognizant of planetary pressures. And lastly, insist on nothing about us without us. So resist, persist, insist. Thank you, Rene.
Thanks. Rama?
I would like to echo what Min has said, and I think I really draw my inspiration from the efforts and see it as a critical link to link networks of individuals and institutions across the world who are committed to a holistic understanding of an ecosocial approach to health and well-being. And I think this is happening, and there are efforts to network, which are very, very important. I think these networks actually bring together and share experiences across different regions that help us to understand ideas in their respective contexts, including as a basis for what we mean by global. Thank you, Rene.
Thanks.
Thank you for the question, Rene. I'm energized by some of the work that we're doing at the Alliance for Health Policy and Systems Research on the commercial determinants of health. I think this is something that we all have an understanding of, but I think some of the published and the kind of the more commonly used understandings of this are largely from certain countries, the US, the UK, Australia, whereas in all of the regions included here and others in countries and communities, we have an understanding of these commercial determinants of health. And I don't think this has yet been reflected in the published research. And this is a problem. It limits our thinking, it limits our ability to conceptualize, it limits how we redress these determinants. And so something I'm very excited and inspired about is that we've been working, we're in the very early stages, but we've been working with some partners in countries and in regions to look at and understand, interrogate how this concept is understood and conceptualized from a regional perspective. And I'm hoping that we can also break that down in the future to a country level as well, and understand how countries understand this concept, so that we can ultimately then use this experience to kind of strengthen our global understanding of commercial determinants, and also improve how we address them. And that's something where I think the Alliance is well placed. Being based at WHO, we can influence and shape how the World Health Organization conceptualizes this issue. Over.
Thanks, Robert.
Thank you very much, Robert. I agree that efforts to link and shape ideas bottom up inspire. Our joint work in deeper dialogue and analysis across different regions that we have talked about in this session, respecting and learning from the diversity in different regions, including what is shared, has been an inspirational practice, and one that we hope can be more present in global processes. Thank you.
Thank you, Eugenio. And from my side, actually, in my life, probably giving away how old I am, but I've had the privilege of living through the reality of how our own region struggled for an organized change to meet social justice, and to be able to work in that period of exciting innovation and the practice that social justice-oriented policy unleashed, where we created space for local ideas. And we used those ideas from other parts of the world, not because they were imposed with money or with power, but because they made sense to us in terms of our own realities, and they were shared with solidarity for what we were trying to achieve. So that sort of real alternative, and it has inspired and informed me, even during the times of structural adjustment when we've been told TINA. I don't know if you've ever heard of TINA, but TINA stands for there is no alternative. And I know, because I've lived through it, that there is an alternative to these kind of very dominant suppressive systems. So thank you, Robert and Rama and Min and Eugenio, for the inspirations and the contributions and the thoughtfulness of those contributions. And I think they show how different and contesting ideas, constructively contesting ideas, can influence and exert power on how we act on well-being. And we've heard about how in the most polarized form, the pathogenic biosecurity modernizing framings have actually dominated at times over the more social and structural and ecological framings. But we're beginning to see these more intersecting, more holistic framings emerging in terms of, and the movements that were informed by them, emerging from local realities and from local cultures and experience. We've talked about it today in India and Latin America and the small island states in East and Southern Africa. And I'm sure it exists in other contributions that will come to this conference from other parts of the world. And that this reemergence of ideas is not only confronting alienation and the inequities that are generated by colonialism and the neoliberal globalization, but they're being revived because of their relevance to today's crises. So I think it points as an organizing principle of the need to respect plurality and diversity. Indeed, we could say this is an organizing principle for an ecosocial world. And this implies the kind of listening that I think Robert talked about at global level to what is going on, but also the fostering of networks to bring ideas into policy, to provide spaces to debate, not to shut things down as Rama was talking about, but to open up spaces for debate and contesting ideas, to invest in a more equitable circulation of ideas. We know that not everybody has access to the digital space to even listen to this presentation. We need to tackle these sorts of issues and invest in the more equitable circulation of ideas between regions and between peoples in framing global approaches. And also to invest in the kind of transdisciplinary, reflexive and participatory ways of building knowledge that Min was sharing, that are actually embedded in and they learn from action. I think we've heard about how much the COVID pandemic and the current crises and growing inequity and conflict that we're now experiencing and have been experiencing are signals. They're signals of the need for urgent change. But we've also heard inspiring practice and experience and persistent pressure for social, economic, and ecological justice that actually show the possibility of change. So I hope we have inspired you in this session, and thank you very much for joining us in it. We hope it stimulates your own discussion, your own debates, your own spaces for provocation and for listening, and we welcome feedback. We'll show in a final slide a link to the papers that I think have been referred to in the presentations. And in the papers there's also contact information. But we are living in this Gramscian moment of old and new ideas, and we're all being challenged to rethink, all of us. So let's welcome the diversity and the contestation of ideas that makes us rethink. And in so doing, let's listen to the often neglected stories, the experiences, the voices, and the embedded knowledge, so that we can explicitly shape pathways for our collective ecosocial well-being around values of reciprocity and equity. Thank you very much to you for listening and to our panel.